Hello, we are going to do a case study on personality disorders. This case study is about Jennifer. Um, so we're going to discuss a little bit about what is going on with Jennifer and her history and what her current problem is that she is here for. So it appears that Jennifer loves attention she receives from men, but this is where she has issues due to her father leaving her mother when she was 8. Jennifer has had interpersonal issues with the men she has dated, which leads to impulsive behaviors. Jennifer has experienced trauma in her life due to being sexually assaulted when in college. Jennifer becomes quickly attached to men, but then pushes them away when things become serious. So that brings us to our problem of more recently, Jennifer has moved across the country to be with a man, but the relationship ended with Jennifer being seriously depressed and she attempted suicide. So, what does the personality disorder that fits best with what's going on with Jennifer? Uh, in my opinion, I think borderline personality disorder fits best with what Jennifer is expressing. According to the DSM-5, in order to meet criteria, the individual would have to meet 5 or more of the following symptoms, which is fear of abandonment, unstable relationships, unstable self-image, impulsivity, self-harm, or suicidal behavior, emotional instability, emptiness, intense anger, and paranoia or dissociation. So this is why I think Jennifer meets criteria for borderline personality. So Jennifer kind of meets at least 7 out of the 9 criteria. I would say she meets abandonment, mood instability, impulsivity, and unstable relationships are like the main symptoms that Jennifer is experiencing, but she's also experiencing self-harm slash suicidal behavior, feelings of emptiness, and unstable self-image. And all this has to do with her like relationships with men and how she perceives herself in men. So the course of treatment for borderline personality disorder. Borderline personality disorder is treatable through psychotherapy. Medication can be an option, but it's used mainly to treat other associated mental health disorders like depression and anxiety. I would say the 2 major forms of therapy used for borderline personality disorder is dialectical behavioral therapy and cognitive behavioral therapy. DBT is more widely used because it helps people tackle their emotional regulation and interpersonal relationship concerns, while CBT is used to treat the client's impulsiveness and self-image through their thought process. So, personality disorders have 3 clusters that they can fall under, cluster A, B, and C. So, borderline personality disorder fits in the cluster B of personality disorders. To start though, let me go over what cluster A and cluster C are, and then we can rule those out. Cluster A personality disorders are considered odd or eccentric behaviors, while cluster B personality disorders are dramatic, emotional, or erratic behaviors, and cluster C are more fearful or anxious behaviors. So based off all 3 of those clusters, Jennifer falls under the behaviors of cluster B, where she experiences intense, unstable emotions and impulsive and dramatic actions. Prognosis of BPD. So people with BPD can improve over time. They just have to maintain their treatment regularly to manage their behaviors and symptoms. For most, BPD usually starts in late adolescent or early adulthood. With management in adulthood, individuals can be in remission from any BPD-related behaviors. Studies have shown that after the first assessment, in over 2 years, 1/4 of clients have experienced remission. Prevalence of BPD. The prevalence of BPD ranges from 0 0.7 to 2.7, where BPD is often more seen in the female population, as discussed in our discussion questions throughout the week. Men aren't as seen as often with BPD compared to women. Men are more seen with antisocial personality disorder or have more issues with substance abuse. In a clinical setting, BPD is seen in both outpatient and inpatient settings more frequently than we realize. Especially women in this population are seen in both of these settings compared to men. Here are the references that I used to help me find my research on BPD, and also it helps me explain why I believe BPD fits with Jennifer's diagnosis. Thank you.